Habibi, you don't join your wife when she's pregnant? Huh? You don't join your wife? You go with your wife? Or you, no, I don't care. How many of you join the wife for the follow-up pregnancy? شنو شنو؟ Brothers, it is important to be with your wife when she follows up the pregnancy. Okay, even during giving birth, it is important. Do you know or not? Psychologically, it is important for the wife for giving birth to make it easier, inshallah. Emotional support. Habibi, I'm not talking about Kuwait or India. I'm telling you something. I'm telling you a fact. You accept the fact, you don't accept? Yes. Yes. Private. I don't I don't recommend the government. This is the government is a mushkila. Here they don't respect the process. Medically, I'm talking about medically, and of course also Islamically it is totally corrupted. A big problem. Subhanallah, the woman. Not only that. They don't respect the woman as a human being. I will not say as a Muslimah, as a human being. They don't respect. 4 ladies inside one room. This lady is shouting, and this lady is waiting, and this lady. One room. 4 beds in one room. It is not allowed to use the mobile. I remember this before 20 years. Now I don't know if they change it or not. Allah alam. Okay, but I remember that. Wallahi, this is a problem. Why it is not allowed to use the mobile? She wants. Also, it is not only the husband. It is not allowed for the mother or the sister. It is not allowed for anyone to join the lady. Why? You see the cleaners going inside. I hope that I'm cleaner now. Well, I remember one of the mothers. Okay, she was waiting. Her daughter inside. What is happening inside? She doesn't know. Wallahi mushkila. She doesn't know what is happening to my daughter now. And she's looking the cleaner going. She said, I hope that I'm a cleaner. That to enter. Wallahi, this is a disaster. Why it is not allowed for okay, if you don't like the husband because there are all of them ladies, okay, at least the sister, the mother, a close friend. She needs a support. Islamically, this is wrong. The lady, she's inside, and also they are preparing the lady for giving birth. It means without hijab. Why? Because you should be prepared for birth. So of course your niqab will not be with you. It is only a curtain, and doctors enter without rules. Who said that? From where? Is it written in the Quran? There is an exception for the doctors? Even in medicine, the rules of medicine. Okay, the doctor should take permission. But the problem, many doctors don't follow the rules of Islam, and also they don't follow the rules of medicine. Taking medicine, I am a doctor, why should I? Open the door, yallah. Maybe if he's a good doctor, then he will enter. He will not wait. Khalas, I knock the door. Habibi, they are women. She's outside, she is with full hijab. And inside the hospital, no rules. Some of them have the concept inside the hospitals, no rules for hijab. Why? Because this is darura, emergency. Who said that? Subhanallah. This is a mushkila, a big problem. I will not say only in Kuwait. Everywhere. What I know, everywhere. They don't respect the awrah. They don't respect the awrah. Okay, maybe for the non-Muslims they respect. Why? Because they are afraid. Maybe يعني خلاص no. But for the Muslims, والله مشكلة. I am a doctor. One sister, okay, يعني one lady, when the doctor came in, she covered because she is niqabi. He got angry. Wallah, he's shaitan. This doctor is shaitan. He got angry because she covered the face. The lady inside the labor room covered the face. He got angry. I'm like your father. You are not my father. You are shaitan. Wallah, you are shaitan. This doctor is shaitan. And some of the doctors pull the niqab from the lady. Wallah, strange. Yani, of course, yani, sometimes we cannot do something. Why? Because the lady should go and complain. The lady should go and complain. But she said, why should I complain? I go to the court and خلاص. He did the mistake. Allah subhanahu wa ta'ala will punish him yawm al-qiyamah. Subhanallah. What is the point? The point is join your wife. If she's pregnant, join your wife. You should follow up. You should follow up with your wife. She needs your support. Okay, she needs that you remind your wife, take this medicine, do this and do that, eat this, don't eat that. Okay, and also when you join your wife and the follow up, maybe there are some points that you need to remind your wife. Okay, يعني maybe in the appointment, you remember, you tell the doctor, wallahi, she's going more to the toilet. This is important. There is a problem with the bladder, or there is something. Okay, this is normal at the end of the pregnancy, in the 8th, 9th month, but still she's in the third month, and she's going repeatedly to the toilet. No, there is a problem. So you need to remind your wife. And also inside the delivery room, this is good for the giving birth. This is good. I mean the support. Okay, stand up with your wife. Okay, hold the hand of your wife. Okay, of course she will shout you. Maybe she will bite you. Not cursing. Yani teach you. Please don't curse. Say everything but except cursing. Maybe she'll bite you. It is painful. Yani. It is painful. It is not easy. يعني, as I said, the problem here, they are not following the rules of Islam, and they are not following the rules of medicine. They are not following the rules of medicine. يعني, I mentioned this before, I think many times. There is a subject called communication skills. I remember in the 5th year in medicine, I mean in the medical school, 10 subjects within 1 year. Okay, for example, the first month, some subjects maybe 4 weeks, 3 weeks, 2 weeks, or more or less. Cardiovascular, respiratory, GI, the stomach and the thing. Okay, and one subject, the communication skills. Okay, this is not important. You will not fail this subject. Okay, no exam. Subhanallah. This is the most important one. Okay, but later I think from 2002, they consider this as one of them, and we give only 10%. Okay, so even if you don't care about this subject, khalas, you can't pass the exam out of 90. Very, very important. Very, very important. Subhanallah. And now I'm sure everyone, if not everyone, most of us suffer from this point. Wallah, yesterday, the day before yesterday, okay, my father in the hospital to take some antibiotic. So I called the doctor, there is swelling in his limbs, in his hands and his feet. She was saying, maybe this is renal failure, maybe there is a problem in the liver cirrhosis or something. Are you crazy? How come you say this word? renal failure. يعني, do you know what it means, renal failure? Okay, يعني, this is wrong. I mean, medically, this is wrong. This is wrong medically, because you know there are rules for something called breaking news. Breaking bad news. They were teaching us how to break the bad news. The patient has cancer. The patient has hypertension. The patient has a chronic disease. Then when she went inside and she saw no, this is normal because of the bed. Okay, why did you say renal failure? Why? Subhanallah, for some doctors, maybe cancer. Maybe cancer. حبيبي شنو maybe cancer? This is not مطعم هندي بطاط فلافل, maybe more فلفل. والله يعني some of the doctors, والله, they should not work in the hospital. They should not work in the hospital. Huh? Slaughter? No, they should not work any place. Well, this is a big problem. You have to make sure, one of the main points about breaking bad news, you have to make sure 100% double check the diagnosis. Don't say any word. I mean, the diagnosis, if you are not sure, or you are sure but you need double check. Cancer? يعني, for doctors, this is something common. Why? Because every day they are repeating the word cancer, maybe 10 times, 20 times. Renal failure, cancer, diabetes, hypertension. For them, this is something very normal. But of course, they will not accept this for their parents. Subhanallah. I mean, I'm talking about medicine. Okay. شوف, women pulled me to the... Okay, join your wife, خلاص, during the delivery. Okay. If you, always I'm recommending, if you can afford the private hospital, okay, pay for the private hospital. Wallahi. If it is, if you expect normal delivery, yes, do it. Why? To be with your wife, there is privacy. Okay, and you pay sometimes more, maybe 40 kd, 60 kd. They give you the permission, you enter the room. If not you, maybe your mother, her mother, your sister, her sister, to join. This is important. I mean the support like that. And subhanAllah, usually they don't care about the awrah. Your wife, uncover, because she is moving, it is very difficult. Okay? So she will uncover the awrah. Okay, for some of them don't care, or maybe most of the nurses and doctors don't care. Do you think that she will come and she will cover? Huh? They don't care. Many of them, or most of them.